I want to welcome all of you in the room today and all of you who are watching. This is obviously a tremendously important issue for the nation. First and foremost, I'd like to thank Attorney General Holder for being here today. He has been an incredible leader and partner in our work to really reform drug policy in the United States. Thanks to your leadership, the United States is leading the world in pursuing a drug policy that's smart on crime, not just tough on crime. And I think all of the initiatives that we've seen in terms of your support for expanding the use of naloxone, overhauling mandatory minimum sentences, reducing barriers to employment and housing and education for justice-involved individuals, many of whom has histories of substance use disorders, is really making a huge difference to the work that we're doing. So thank you, and we look forward to hearing you today. We're also joined by Vermont Governor Shumlin, who has graced us with his presence. And many of you know, I think all of you know, Governor Shumlin dedicated his State of the State address to the serious challenge of opioid abuse in Vermont, kickstarting really unprecedented efforts and conversations in his state and around the nation to address the challenge and increasing awareness of this issue. Governor Shumlin understands that this is something many communities have been dealing with for a long time and that we are not powerless to make a difference. Thank you, Governor, for being here and for working so hard to save lives. We're also joined by Dr. Nora Volkov, who is from the National Institutes of Health, leading the National Institute of Drug Abuse. She is a national and quite honestly world leader in the field of addiction research, and her pioneering work on brain imagery has reshaped our thinking of how we deal with addiction, not only in this country but in the world. We are very fortunate to have her with us today to share the latest research and outline the public health effects of this epidemic. I'd also like to thank everyone who is in this room today and many more who are joining us. All of you have been such heroes in this effort, have been doing unprecedented work in really helping us to deal with this issue in many fronts. Our law enforcement partners, our public health pioneers looking at prevention, treatment, and recovery support services, as well as our federal partners. So we really want to thank you not only for being here today, but for all of the work that you've been doing on a daily basis to really address the tragic consequences associated with these issues. I don't need to remind anyone in this room, but I am anyway. The Centers for Disease Control and Prevention drug overdose deaths now surpass traffic crashes as in the number of injury deaths in America. In 2011, a staggering 110 Americans died every day from an overdose, every day. Prescription painkillers were involved in nearly 17,000 of those deaths, and heroin was involved in more than 4,000. But as shocking as these statistics are, and I know we all have a hard time wrapping our heads around those numbers, they really pale in comparison to the stories of individuals, families, and communities who have lost loved ones to this epidemic. The slide behind me shows the face of just a fraction of the bright, talented Americans this epidemic has taken from us. These lives that are lost are our friends, they're our family, they're our neighbors, our coworkers, and they have served in our armed forces. One of the most difficult but necessary parts of my job is meeting with parents who have lost loved ones to substance use disorders. It's never easy. And perhaps the most painful thing is knowing that every overdose death in America is preventable. As Dr. Volkov will share, substance use disorders can be prevented, treated, and from which people can and do recover, just like from any other chronic disease. Prevention works, treatment works, reforming our criminal justice system to break the cycle of drug use, crime, incarceration works. Let me give you just one example. Just a few weeks ago, 2 New York City police officers on Staten Island administered a nasal naloxone spray to save a 29-year-old man's life. This is the 6th time this year that police officers on Staten Island have used naloxone, a medicine that can reverse opioid overdoses and to revive a victim. I also want to give special acknowledgement to Lieutenant Pat Glynn from the Quincy Police Department, which was the first police department in the country to equip all of its officers with naloxone. And since they've been implementing that program, they've been able to save over 230 lives. So and who has really been a national champion in spreading the word around law enforcement use of naloxone. The New York City Police Department decision to put naloxone in the hands of police officers began with a pilot program on Staten Island, supported by ONDCP and funded in part by ONDCP's High Intensity Drug Trafficking Areas program. Law enforcement, together with public health professionals, are making a difference to reduce this epidemic, and you'll hear more about that work today. I don't want to speak for a very long time, although many of you know I do, so that we can hear from many of our distinguished panel members who have pulled together this discussion. So before turning this over, I'd like to let you know what we hope to accomplish for today. First, I hope this meeting will build on the work that Governor Shumlin and others have done to spur action at the federal, state, and local level to support a more holistic approach to this epidemic. As has been said many times, we cannot arrest our way out of the drug problem. By taking evidence-based steps, such as expanding drug education for young people, training doctors on proper prescribing patterns, intervening and providing treatment before a substance use disorder becomes chronic, improving access to medication-assisted treatment, and expanding recovery support services, we know we can save lives. And I hope that the experience and expertise of everyone in this room will serve as a resource to other communities looking for ways to address this challenge. Second, I hope that we can take advantage of where we are today to dive deeper into the issues surrounding this problem. Beyond overdose, for example, what is the effect of this epidemic on the spread of infectious disease? How do we make sure that our response is coordinated, not just at the federal level, but also at the state and local levels, to address the consequence of opioid abuse, including the spread of HIV and hepatitis? Third, we must be mindful of the interconnectedness between prescription drug abuse and heroin use. It is impossible to understand our nation's heroin challenge without understanding our prescription drug abuse challenge. How can we apply solutions that address both? Finally, how do we adapt to the changing nature of this epidemic? In 2011, we released the President's Prescription Drug Abuse Prevention Plan for responding to the prescription drug abuse epidemic. 3 years later, opioid abuse is spreading to different users, particularly young people. How can we work together to deal with this changing demographic? Let me close by reminding everyone that despite the seriousness of the public health emergency that we face, we can do better and we can be smarter about how we address it. A smart public health approach requires us to catch the signs and symptoms of a substance use disorder earlier, before it develops into a chronic disorder. A smart approach requires that we all work together at the federal, state, and local levels. That public health approach also that we work in concert with our public safety and our justice colleagues. That is why the administration is dramatically expanding access to drug treatment through the Affordable Care Act. That is why we are working to educate doctors on proper prescribing practices for prescription painkillers. That's why we encourage Americans to properly dispose of unneeded or expired prescription medications. And that's why the Justice Department closed down so many pill mills in Florida and continues to work hard to make sure that they don't relocate to other states. But we can't stop here. As I said earlier, it is important that we understand the trends so that we can deal with them effectively and that we can identify best practices to address this epidemic. I'd like to thank you all again for being here today, and with that, I'd like to turn it over to the Attorney General.
Well, good morning. And thank you, Michael, for all that you're doing, for your more than 2 decades of service and leadership in confronting the crisis posed by substance use disorders, and for all that you and your colleagues at the Office of National Drug Control Policy do every day to forge safer and healthier communities. It's good to have the governor here with us as well. I think that we can't let go unnoticed what the governor did in that State of the Union address, or State of the State address. For him to get up there and dedicate his State of the State address to a question of substance abuse, I think was forward-thinking and gutsy. And it's the kind of leadership that we don't see often enough in this country. I want to laud you for what you did, Governor. It is a pleasure for me to help welcome this distinguished group to the White House for today's important summit. And I think it's also a privilege to stand with so many experts, advocates, and extraordinary leaders from America's law enforcement, public health, and education communities. The dedication that you have all shown to confronting heroin and prescription drug abuse not only by participating in events like this one, but through your tireless work across the country, is not only inspiring, it makes a tremendous positive difference. And I think you have to remember that. You're making a difference. Your efforts enable us to improve and to save countless lives, and your guidance and your expertise when it comes to addressing the drug abuse epidemic holistically and keeping dangerous substances off of our streets comes at a time when really much is at stake, and that this work could not be more important. Now, you all know as well as anyone the challenges that we face today and how daunting they are. You've shown us that as we seek to address the problem of substance abuse, it makes sense to focus on the most dangerous types of drugs. And right now, few substances are more lethal than prescription opioids and heroin. Between 2006 and 2010, across America, heroin deaths increased by 45%. Now, that's a pretty shocking statistic, but it's only one of many clear indications that we're up against an urgent public safety and public health crisis, one that affects Americans in every state, in every region, and from every background and walk of life. We've learned from scientific studies, from treatment providers, from victims and investigations that the cycle of heroin abuse commonly begins with prescription opioid abuse. And this can make the problem exceedingly difficult to track as well as to overcome. But that's exactly why your participation and your leadership is more vital today than ever before. As federal officials, law enforcement officers, medical providers, and prevention and treatment experts, each of you stands on the front lines of our effort to protect this nation from the truly devastating impact of illegal drug use. And together, through collaboration and cooperation among stakeholders at every level, we are making, I think, significant strides to build a better, brighter, and more secure future for ourselves, and most importantly, for our children. In recent years, we have targeted the illegal supply chain. We've taken steps to prevent doctor shopping by drug users and distributors. We have disrupted pill mills masquerading as pain management clinics around the country. We've developed and advocated for cutting-edge public health solutions on the state, local, and community levels. And as we speak, under the leadership of Director Botticelli and his colleagues in ONDCP, we're implementing the administration's 2011 Prescription Drug Abuse Prevention Plan so that we can target abuse through education, through monitoring, through medication disposal, as well as through enforcement. Now, as Michael noted, these comprehensive efforts are showing promise. But we have to realize that our work is far from over. Significant challenges remain before us, and a range of serious and evolving obstacles lie ahead. Now, I have no doubt, based on the professionalism, the grit, the insight, the guts, that has characterized the work that's underway, that we will confront the impediments ahead with determination and also with strength. And I want to assure you that as you drive our national efforts into the future, you will continue to have not only my admiration and my gratitude, but also my full and unwavering support. My colleagues and I, at every level of the United States Department of Justice, are firmly dedicated to fulfilling the goals we share and combating the challenges on today's agenda. And I'm proud to note that this is a commitment that we're backing up with robust action. Since the beginning of this administration, with DEA as our lead agency, the Justice Department has adopted a really sweeping strategy to prevent pharmaceutical controlled substances from getting into the hands of non-medical users. We have used our regulatory authority to review and to investigate new pharmacy applications to identify and prevent storefront drug traffickers from obtaining DEA registrations. And since 2010, we've joined with our regulatory partners to sponsor 8 drug take-back events that provide the general public with a safe, convenient, and a responsible means of disposing of prescription drugs, providing an incentive for consumers to safely clean out their medicine cabinets. Now, these drug take-back efforts have resulted in the safe destruction of over 2,100 tons of prescription drugs. And DEA is in the process of promulgating a regulation that will make it easier to establish permanent drug disposal sites nationwide. We've also stepped up our investigatory efforts, opening more than 4,500 heroin-related investigations since 2011, and increased the amount of heroin seized along America's southwest border between 2008 and 2013 by 320%. Now, of course, like you, I recognize that we cannot solve this problem through enforcement alone. Michael is exactly right. And we will never be able to arrest or incarcerate our way to becoming a safer nation. This is why education, prevention, and treatment, along with vigorous enforcement, must all be significant components of any comprehensive solution. Over the past few years, the DEA and others within the Department of Justice have stepped forward to help educate pharmacists, doctors, and other health practitioners in the identification and the prevention of controlled substance diversion during the healthcare delivery process. In the Northern District of Ohio, for example, our U.S. Attorney out there, Steve Dettelbach, convened a summit at the Cleveland Clinic, bringing together health and law enforcement professionals to address that area's nearly 400% rise in heroin-related deaths. And across the country, DEA has participated in numerous conferences at the request of professional healthcare practitioner organizations to educate their members on prescription drug abuse and diversion trends. Additionally, since 2011, DEA has sponsored 34 pharmacy diversion awareness conferences in 16 states, training over 6,500 pharmacists and pharmacy techs in prescription drug abuse trends, the Controlled Substances Act, and the pharmacist's role in preventing controlled substance diversion at the pharmacy level. Now, on the national level, we're moving even more broadly under the Smart on Crime initiative that I announced last August to put in place a range of targeted systemic reforms to ensure that 21st century challenges can be met with 21st century solutions. This groundbreaking new effort relies upon proven, evidence-based, I want to stress that, evidence-based strategies to achieve better outcomes throughout the federal criminal justice system, and particularly with regard to nonviolent drug-related crimes. These policy changes are predicated on the notion that our work must be informed and our criminal justice system continually strengthened by the most effective and efficient strategies that are available. We're also strengthening diversion programs like drug courts, veterans courts, and community service initiatives so that we can provide alternatives to incarceration for some people and offer treatment and rehabilitation to those who need it the most. Nationwide, the Justice Department is supporting more than 2,600 specialty courts that connect over 120,000 people convicted of drug-related offenses with the services that they need to avoid future drug use. And we're striving to improve and to reinforce reentry programs and initiatives from coast to coast so that we can enable formerly incarcerated individuals to return to their communities better prepared to contribute and to lead as full and productive members of society. Now, let me be clear. We're never going to waver in our commitment to act aggressively to keep America's streets safe and our children free from drug addiction and abuse. And we will never stop being tough on crime and the choices that breed it. But like you, we also recognize that we have to be smart, we have to be efficient, and we have to be effective as we strive to disrupt and to diminish the scourge of addiction along with the underlying conditions that trap too many individuals in a vicious cycle of drugs, criminality, and ultimately incarceration. Now, like many of you, my dedication to this work is personal as well as professional, because as a former U.S. Attorney here in Washington, D.C., and as a Superior Court judge in this great city, I have witnessed the devastating impact that prescription drug and substance abuse can have on individuals, on families, and on entire communities. I understand the importance of bringing law enforcement officers, community leaders, public health professionals, prosecutors, and other stakeholders together to confront these conditions. In fact, during my tenure as U.S. Attorney here in Washington, D.C., my staff and I pioneered the first ever community prosecution effort in our nation's capital. And we saw both the power and the necessity of employing an approach that draws on the passion, the knowledge, and the expertise of a wide range of authorities and citizens. And based on the diverse perspectives that I think are represented here today in the White House, I know that you share that confidence. You recognize that necessity, and that's why you're making sure that our efforts don't end with treatment, they don't end with incarceration, or they don't even end with community outreach. Because when it comes to prescription drug and heroin abuse, The problem doesn't really begin in prisons or in gangs or in forgotten areas of our city streets. It begins in our neighborhoods. It begins on our playgrounds, in our school. It begins all too often in our home. Now, at the end of the day, the most important work that we do is invariably the work that takes place within our own communities, not simply as professionals, but as mentors, advocates, as counselors, as parents, neighbors, and as friends. We need to make sure that our kids live in neighborhoods where adults can reach out to them, where moms and dads, teachers and faith leaders, Little League coaches, scoutmasters can be trusted and positive influences in young lives. And this work must be embraced by whole communities, by states, the way it's been done in Vermont, because it is only by standing together through collective action and comprehensive effort that we'll be able to make the difference that we all seek. So we need your expertise, but also your passion, your dedication, and your proximity. We need your boots on the ground and your ideas in effect here in Washington and around the nation. Now, especially over the last 5 years through summits like this one and the partnerships that you forged on the front lines, national leaders in and far beyond this room have come together to learn, to strategize, to collaborate, and ultimately to act. Today, we reaffirm our commitment to push these efforts forward, and we renew our pledge to break down traditional silos of responsibility, to rally additional experts and allies to this cause, and to use every tool and every authority at our disposal to help navigate the complex and the interconnected challenges that remain before us. We have seen, after all, that progress in this area will not come easily. Positive change will not occur as quickly as we might like. But forums like this one are a testament to the importance of cooperation in the face of adversity. And as long as we keep our commitments to one another, as long as we keep seeking out new ways to work together, as long as we keep striving to build on the promising work that so many of you are leading, I believe there's good reason for confidence in where those efforts will ultimately take us. So I'm proud to count you all as colleagues and partner in the considerable work that remains before us. I want to thank you once again for all that you're doing today and every day to combat drug abuse and to protect the future of this country, to protect our young people. I look forward to all that we'll accomplish in the months and years ahead, and I wish you all a most productive summit. Thanks very much.
Thank you so much, Attorney General Holder. That was extraordinary comments. Great way to kick off this summit. And I want to thank you for your leadership on this area. I remember when I was running for governor in Vermont, you had already, been elevated, and I was hoping to be. And you came to Vermont with Senator Patrick Leahy. I call him St. Patrick Leahy. And you were there, it was in the first few months after you've been sworn in, to talk about the effects of prescription drugs, addiction, and the challenges that we're facing as a country. And that State House, where you probably remember that meeting well, was absolutely packed, just packed with law enforcement, with prevention folks, healthcare workers, treatment folks, trying to figure out a solution to this. So I thank you for your courage. I think you're the first Attorney General in the history of America that has said, listen, if we ask law enforcement alone to solve this problem, we're going to keep losing this battle. And you had the wisdom to go out and say, we got to be a lot smarter about partnering with all aspects of the health community, tough on crime, as you mentioned, but smart on crime, to ensure that we get this right. So thanks for your leadership. I can tell you that I've learned from your efforts on naloxone, no question that your leadership there has helped all of us. And I know I'm proud to be I believe the first state that got naloxone to every single first responder, every single healthcare provider. We now are going to be passing it over the counter if you demand it, so that anyone who wants it can get it. And that's saving a lot of lives all across America and frankly in Vermont. So thank you. You also may recall that you helped Vermont get funding for a great film, The Opiate Effect, which has been championed by you and your team. So thank you from the bottom of my heart, and thanks to your comments. And we're all in this together, but we're lucky to have you as Attorney General, the Attorney General who gets it. I also want to thank you, Director Botticelli, for your leadership, for pulling together this summit, to your team, Katie Green and the rest. Thank you very much for including me. I'm honored. And to Dr. Volkow, thank you so much. I'm looking forward to hearing from you, because you actually know what you're talking about, which I want to be very clear, I don't. So I want to say thank you so much. And to all of you that are participating today, this is extraordinarily important. And so I'm just honored to be a part of it as a humble governor from a small state who kind of got into this issue the old-fashioned way. I remember him from one of the smallest states in America. We have about as many people in our state as you'll find in the city of Baltimore. And what dignifies Vermont's quality of life is a sense of community, people working together, neighbors helping out neighbors, neighbors reach out to strangers. We have among the best quality of life in America. As I went around Vermont as the governor, and in Vermont, it's a little different than the bigger states. If Vermonters don't see you every few days, you're not doing your job, and you won't get reelected. So I just run around Vermont all day long in circles. And you have to remember that Vermont and New Hampshire are the only two states in America where they have gubernatorial elections every 2 years, not every 4, so I run even faster than my fellow governors. And what I started hearing from Vermonters, and this is what's so great about my job, they just come up to me more and more frequently and say, you know, whispering, head down, often looking shameful about sharing this with me. You know, we've lost our son. We've lost our son to opiate addiction, or we've lost our daughter, or young people saying, my mom, or my dad, or my nephew, or my niece. And it's destroyed our family, and it's destroying us. I found that if I wasn't getting approached by Vermonters who had family members, neighbors, or friends who were addicted, I was getting approached by folks who would say to me, you know, my store has gotten ripped off 4 times this year, and we never used to get ripped off. My car's gotten broke into. You know, Vermont's a state where you can usually leave your key in the car, but it's gotten broken into because we've had to start locking them in some communities. My house, what's going on? And I just started listening. And really, the stories that what I was hearing from people across Vermont, suddenly a light went off in my head. And I said, you know, this is something that nobody wants to talk about. This is a disease that we all tend to discriminate against. And this is an issue where if leaders who are elected don't lead, at least in the case of Vermont, we will lose the quality of life that we so cherish as a state. Lose it. Gone. The one thing that threatens Vermont right now, and I would argue the other 49 states, is turning our head to the opiate addiction that is ravaging our communities. So when I started talking about this with my staff, and I said, I really want to talk about this in my State of the State, and started talking to them about why, you know, for those of you that have a big staff, you can understand how excited they were about this. And they said, how much of your State of the State do you want to dedicate to this? I said, all of it. You can imagine how excited they were about that. But I'm grateful that I did, and I'm grateful that we're having a conversation. And I'm incredibly grateful to Director Botticelli, to the White House, to the President, to the Attorney General for putting us together in this room and on webcast all over the place, because we're all in this one together. So let's talk a little bit about what the challenge is. In my little state, we have concluded that when OxyContin got approved by the FDA and we passed it out, as that great Washingtonian Alan Greenspan would have said, with what only can be determined as irrational exuberance. Irrational exuberance. We started getting folks addicted to OxyContin. And when the Attorney General was in Vermont 7 years ago, that was the problem. Well, we got smart, and we changed the formulary so that you couldn't crush it, you couldn't shoot it. We did some things. And then guess what? People who were addicted to OxyContin, the street value went up to $80 a pill in my little state. So folks turned to the next cheapest and, frankly, more intense high, which is heroin. Now, here's my challenge as a governor, and I bet this is true for almost every rural state. You can buy OxyContin on the streets of Vermont for 80 bucks a pill. You can buy a bag of heroin on the streets of Vermont for 30 bucks a bag. You can buy that same bag of heroin in Springfield, Mount Holyoke, Philadelphia, New York, Boston, and other cities south of us for $5 a bag. So, forget your hearts for a minute. Just with your heads, do the math. 4 to 5, $6 a bag, 3 to 4 hours south of us on an interstate highway. 20 to 30 bucks a bag in Vermont. There's a huge economic incentive to get this junk into my state. And it's happening. So when people say to me, why Vermont? Great quality of life, great maple syrup, best cheese in the world, best beer in the world. I was telling the Attorney General, we now got the, more microbreweries per capita in any state in the country. We've won the 3 best beer awards for the world in the last few years. Best quality of life, best skiing, best place to work, to live, to work, raise a family. Why Vermont? I said, I think the difference is that in Vermont, it's not that it's why Vermont, it's that we're so small, we have such tight communities, we cherish our quality of life so much, we're willing to talk about it. So it's incredibly important that we're all in this room together talking about a 50-state challenge that we're all in together. The second thing I learned about this discussion is when we think about heroin addiction, we think about inner cities, a lack of opportunity, and desperation. Well, guess what? That isn't true of the people getting addicted to heroin and OxyContin today. If anyone tells you that they didn't go first to FDA-approved opiates and then to heroin, all I can tell you is they are the vast exception to the rule. The vast exception to the rule. What we know is that this is a disease that afflicts all incomes, rich and poor. It afflicts people of all origins. It afflicts people from all political parties. It is all of us. And that's incredibly important to remember when we talk about this disease. Since 2000, our little state has seen a 770% increase in treatment for opiate addiction. 770%. We've seen an over 250% increase in people receiving treatment for heroin in Vermont since 2000. 250%. Nearly 40% of that increase we've seen in the last 12 months alone. And I'll bet you that that's true in the other 49 states too. So what are we doing about it? In Vermont, we've done a few things. The first is, and I'll recite a story for you, and this is what really drove me on this one. I was talking to a young addict in recovery. He grew up on a dairy farm up in Franklin County. We got a lot of dairy farmers in Vermont. Hard-working family, mom and dad, lots of kids, beautiful farm. 10th grade, exam time, he's offered an OxyContin by his buddies during the break-in exams. He takes it. He's never felt so good. He becomes an addict hard and fast. 5 years of addiction. Does what addicts do. Rips off his friends, rips off his family, will do anything to feed this debilitating disease. $20,000 worth of farm equipment stolen from his family to sell, resell, get the money to buy the drugs. Bottom line, when he finally bottomed out, when he was finally ready to go into recovery, when he could go no lower, his mom calls my treatment folks, says, my son Dustin's addicted. We need to get him treatment. He wants to go to treatment. Who can help him? My folks said, sorry, we've got waiting lists for treatment. We can't take him. He said, well, what am I going to do? She said, well, is he suicidal? He said, no, he's not suicidal. He's addicted. She said, sorry, we'll put you on the list. Well, she was an ingenious dairy farmer. She called back and got someone else on the line, said, my son is addicted and suicidal. Can you help? He got treatment. My point is simple. I recognized I needed to have a system to treat this disease like any other disease that someone suffers from in the state of Vermont. You call it and you get cancer. You know, you think you're having symptoms of cancer or heart attack. We don't say, you know, are you suicidal? So we put up what we call a hub and spoke system, where we're building treatment centers in every significant community in Vermont, state-of-the-art treatment centers with great healthcare providers. And then we have a system of what we call the spoke, other providers, nurses, community leaders, principals of schools, feeding people into the hub. It's working. We believe that by next year, we will not have waiting lists for people who are ready to be treated. The federal government has been incredibly helpful to us in that. In a little small rural state, millions of dollars of help. That's critical. Let's keep on that. Second, in addition to getting rid of treatment, waiting lines for treatment, the second part is how we treat them. Now, as you know, methadone and bupe are the two main sources of treatment. Bupe can be abused as easily as OxyContin or heroin if you're not careful. So first of all, putting a system in place that really monitors the recovery is critical. Also, being willing to look at new methods of treatment is critical. We're looking at Vivitrol right now. I don't know what other states are doing. But really figuring out how we're doing treatment, not just saying we're going to do treatment, but figuring out how to get it right is critical to every state across the country, and the federal government can partner with us on that. Third, I signed a bill 2 days ago that moves the entire state, our prosecutors, our judges, to what we call a evidence-based, expedited treatment system. What does that mean? What I learned about this disease is that opiate addicts are the best liars and the best deniers that you'll ever meet. They will do almost anything to support their habit. We know that. That's why we have crime. That's why we have terrible outcomes when people are addicted. What I found was that the evidence suggests that their most likely moment of getting that addict to face the music, to come out of denial, to accept that they have a problem, is the moment where they bottom out, which is usually when the blue lights are flashing, when the handcuffs are on, when they're heading in to be charged. That's why strong law enforcement is such a critical piece of this puzzle. So when I looked at what we were doing in Vermont, I bet this is true in the other 49 states, you get busted, that's your moment of opportunity, and we totally miss it. We say instead, hey, great, 3 or 4 months, you'll come before the judge. Well, listen, by then they're back using, they're back abusing, they're back denying, they're doing all the things that feed the disease. So what we're saying in Vermont is, we're going to give our prosecutors, with state-supported dollars, the ability to immediately, when you're busted, have a third-party assessment. That assessor is a pro. They talk to you, they figure out your history, they look at you, they work through it, and they come back with a report almost instantly that says either, this is something that you should be afraid of, in which case we'll do it the way we've always done it, or this is someone who you should perhaps be mad at, disappointed in, feel empathy for, but someone who needs to get help, not someone who is going to murder you, to hurt you. For those folks, we will say to them on the spot, listen, you go into this extraordinary hub and spoke treatment program. We're going to follow you through it. We're going to support you in it. We'll get you wraparound services, housing, mental health counseling, job training, all the other things that come with the disease. And if you succeed, you will never be charged, you'll never have a criminal record, and we'll get you back, as the Attorney General said, as a productive member of our community with a job, back with your family, back into recovery. It's just smart. It's common sense. So evidence-based expedited treatment with third-party assessments. And finally, as I mentioned, we want to be the naloxone state. If you need it, you get it. We've got it for you. It's working. Guess what? Just less than a month ago, we had a bad batch of heroin in Burlington. 9 people OD'd and almost died. Because our first responders knew how to administer naloxone, guess what? All 9 of them are now in recovery. They're not dead. we lose over 100 Americans a day to this addiction. Think about that for a minute. Imagine for a moment that we were losing 100 Americans a day to untreated heart disease. You know, we just said, hey, sorry, we can't help you. Or to terrorism. 100 a day. Imagine what we would be doing. 3 days ago, Governor Deval Patrick of Massachusetts called together all the Northeast governors. We had an incredibly productive meeting there with Governor Hassan, New Hampshire, Governor Chafee, Rhode Island, Governor Malloy of Connecticut, Governor Patrick, and myself. And we talked about how we can start using our prescription drug data monitoring systems to better figure out where people are abusing the access to OxyContin and other opiates. We're going to talk about cross-treatment, border treatment opportunities, where one of our facilities might be full, we can go across the border, try to get Medicaid, Medicare, and others to help us in having a more flexible payment system so that state lines don't become the borders to recovery, obstacles to recovery. We're going to do whatever it takes as a region to get on top of this one. So listen, I've rambled on for a person that doesn't know much about this long enough. I just want to say this. There are a couple of issues that I think we have to keep fore and foremost in our minds as we move this from a law enforcement challenge alone to one where we're all in together saying this is a disease that needs to be treated. The first is the stigma stuff. We've got to get over the stigma stuff. You know what my biggest challenge to setting up treatment facilities is? And I bet it's true across America. Fear. Folks who say, not in my backyard. Now, it's interesting that we all kind of avert our eyes to addiction in our front yards, and then we fear and fight treatment in our backyards. Listen, America, we got to get over that. Folks who are in treatment are no more dangerous than folks who are in treatment for other diseases. All the evidence suggests that. We're getting them back into a healthy recovery. That's not the time where you fear them. Where you should fear them, is where you avert your eyes to them on Main Street, not when they're getting treatment in a good facility. Second, I think it's worth mentioning that the way we treat our attitude towards this disease really matters. Listen, my dad about 6.5 weeks ago passed away, and we've all had to go through the loss of a mom or a dad, or if you haven't, I'm glad you haven't, but it's tough stuff. My dad died of cancer of the esophagus. He was a pipe and a cigar smoker for most of his life. Now, when my dad got the symptoms to his disease, fortunately he was 89, almost 89 years old, we didn't say to him, hey, Dad, you kind of baked this one for yourself. I mean, we're not going to help. Why were you smoking that pipe and those cigars all those years? Or cigarettes, or whatever it might be. When someone gets cancer in our families, we throw the book at them. We try to keep them on this earth. We hug them and love them. This disease is different. Let's be honest about this. When someone suffers from opiate addiction, heroin addiction, OxyContin addiction, I would argue that we don't have the same reaction. We got to stop that. These are our children. These are our neighbors. These are our community members. They can recover. Tough stuff to recover from. Awful, debilitating disease. This is the worst disease you ever want to get. It really is. But you can go into recovery and go back and get your family back and your job back and lead a productive life again. That's our job collectively, to look at it that way. The only thing other I would mention is I think back to when the Attorney General first on a job came to Vermont to talk about OxyContin, and we got smart and we tamper-freed it and did some other things. I just want to raise the question of, are we learning quickly enough? Now, I would argue that when the FDA's advisory panel of 11 docs and other experts consider a drug like Zohydro, and they vote 8-2, I'm sorry, I think there was 11 of them, right? 9 to 2? 11 to 2, it's even worse. 11 to 2, I don't pay much attention to what happens in Washington, but 11 to 2, you know, not to approve this thing because this is like, you know, OxyContin on steroids. And then they suggest, well, it doesn't matter if you can crush it, doesn't matter if you can snort it, it's not even tamper resistant. And we all approve that. I would ask this question, have we learned from the last 15 years? You know, let's talk about this. I sit in these meetings endlessly, talking with governors, with policy leaders, with communities, talking about how we can get a handle on this challenge. If we accept that FDA-approved drugs have led to the heroin crisis in America that's destroying our kids' lives and our families' lives and our neighbors' lives, and we really want a more powerful entry drug to be prescribed legally and sold in America. I don't know. Maybe I'm just been a governor too long, but it doesn't seem like common sense. Finally, I want to say this. If we pretend that this challenge, recovery, belongs to everybody else, law enforcement, this is your problem, judiciary, this is your problem, treatment programs, this is your problem, docs and nurses, take care of this one for us, we will make no more progress than we made when, as the Attorney General suggested, we in the old days said, this is law enforcement and judiciary's problem all alone, take care of it. We've got to involve communities, and the Attorney General made reference to that. In my little town of Rutland, city of Rutland, we've got the mayor, the police chief, the community members, meeting groups of hundreds of folks, and they're going and knocking on doors. They're being proactive. They're bringing people out of houses and apartments and buildings and businesses. When they find that someone's addicted, they actively go in before they get arrested, before they do a crime, and say, listen, we're going to get you the services you need. We're with you. They're looking out for them. And I think that in addition to questioning what we do way up here in D.C. when we make decisions about drugs that we prescribe, we should also remember that every one of us has got to be a soldier in this battle. Every one of us. That when you have a friend or a family member or a neighbor that you know is addicted, it's not okay to turn your head and say it will get better, we hope. That we've all got to roll up our sleeves and get involved, because in the most industrious, productive, imaginative democracy in the world, I maintain that this particular healthcare crisis is the one that can destroy America's quality of life if we keep doing business the way we're doing it. So thank you so much to all of you that pulled this summit together. I'm honored to be a part of it. I'm not an expert on this subject. I can just tell you some of the things I've observed, and I hope that it's helpful. Thank you from the bottom of my heart.
Good morning. It's a pleasure to be here, and I want to thank Mr. Michael Botticelli for his leadership and for inviting me and for taking this issue so seriously. I also want to thank Attorney General Eric Holder and Mr. Governor Shumlin for such inspirational presentations. I think they do highlight the problem and the need that we have to act urgently. I represent the science and from the National Institutes of Health, and as a physician, I also represent the healthcare system. I get criticized, and many others get criticized for describing this as an epidemic of prescription opioid abuse, but I don't really know any other better way of describing it. If you look at actually the numbers and how fast these numbers have crept into our country. What we do with science is actually try to understand, use methodologies that can give us information that, of course, can hopefully help to resolve the problems. So if you look at the problem of prescription abuse, we know what is the prevalence. Following the legal drugs and marijuana, the most prevalent drugs of abuse in our country are prescription medications. And of them, the top prescription medications are opioid analgesics. And why are opioid analgesics used in order to actually, for abuse purposes? Because they stimulate new opioid receptors. New opioid receptors are actually activating reward centers in the brain. Opioid receptors, though, also are crucial in regulating our perception of pain. So when we give a medication, the medication is going to be effective because it's stimulating those centers that regulate pain, but at the same time, it's also stimulating centers that are activated by reward. And that's why opioid medications can be diverted, why they are abused, and why they can produce addiction. So understanding under what conditions these medications can be safe and therapeutically very valuable for those who need them, versus understanding on what conditions they can actually enhance its rewarding and addictive properties is crucial as we do prevention and therapeutic interventions. Because as different from other drugs, we are faced with a particularly complex challenge, which is the concept that if you were to come to me, cocaine or methamphetamine addiction, I said, let's get rid of cocaine, methamphetamine, nicotine addiction off the surface of the earth, no one would suffer. But here we have psychotherapeutics that can be life-saving on certain instances. So we cannot just erase them from the earth. So how do we address that problem? And I think that that is an issue that we have to have not just courage, which is very important, but I also applaud you for your honesty. We need to be willing to observe the phenomena in order to change it, even though sometimes we may not want to be so candid as to state it. But in my view, as a scientist, if I'm not objective, if I not put the data in front of us, then what am I doing? So while it is correct that the pharmacological characteristics of opioids make them amenable for diversion, and that's why they are being diverted and why they produce addiction, that's not the only reason why we have this epidemic of opioid prescriptions. We have also the epidemic because there has been a massive increase in the availability of these medications. And we do know from epidemiological studies that one of the factors that determines the prevalence of abuse of a substance is how easily available there is. And another factor is cultural norms. And in the case of prescription opioids, one of the reasons why individuals state that they favor these medications is because of the belief that they are safe because they are prescribed by physicians. And the reality is that when these medications are taken outside the medical context or even within the medical context without adequate supervision and monitoring, they can be as dangerous and as addictive as the illicit substances. So how is it that we can manage it? Well, just for those that are not necessarily pharmacologists, what we have known from in the research of substance abuse is that the same drug, the same quantity of the drug, can have more or less addictive potential on the basis of how fast it gets into the brain. The faster it gets into the brain, the stronger its rewarding effects, the greater its addictiveness. And this explains why when you take a drug orally, it's much less addictive than when you inject it. Because oral takes 60 minutes in order to get it into the brain. Injection gets it into 3 minutes. And that's why, again, one of the strategies that has been used quite effectively, though is not totally proven, is that administer these medications in ways that you cannot inject them or snort them. And that in and of itself decreases the likelihood that they will be diverted. But as I say, is not 100% proof. Now, what led to this massive increase in opioid prescriptions? Yes, well, people are taking them because they think they are safer, because they are very rewarding. But why did we end up with this massive quantity of prescription medications? Well, at the same time that we're seeing this phenomena that I call epidemic, there is another very epidemic-looking like phenomena of massive amount of individuals in the United States with severe chronic pain. And the Institute of Medicine reported that there are at least 100 million Americans suffering from moderate to severe pain. And in the meantime, there has been an urgency for the healthcare system to address the proper treatment of individuals that are suffering from pain. For severe pain, if chronic pain, or if untreated, the epidemiological data suggests that 1/3 of them is at risk of suicidal behavior. So we have an urgent situation. These two things are colliding. So what happened is the healthcare system actually started to more aggressively treat pain. But they did it without the adequate educational background that would allow them to optimally treat their patients with pain and prevent them from becoming addicted. And thus, this reflects 2 points that straightforward has been addressed before. that even though they sound simple, they are crucial in addressing this epidemic. Education of the healthcare system in the proper management of pain, including management of opioid medications, and education of the healthcare system in substance use disorders. Most physicians don't know how to screen for substance use disorders, they don't know how to recognize it, and they don't know how to intervene. So these two phenomena facilitated the excessive prescription of opioid medications. Well, at the same time, it does not necessarily follow that even though we're massively prescribing medications, we're properly treating chronic pain patients. So when I speak massively, what are we speaking? Well, over a 20-year period, we went from something like 70 million prescription of opioid medications a year in our country to close to 210 million, a threefold increase in 20 years. Over those 20 years, we saw a threefold increase in deaths from overdoses. And over a 10-year period, the last 10 years, we've seen a five-fold increase in substance abuse admissions for substance treatment. And these go in parallel. So we do know that over-prescription, and I call it over-prescription because as Attorney General was speaking that we're recovering tons of medications. You cannot have it both ways. If we're recovering tons of medications, it's because we're prescribing more medication that is needed. Again, highlighting an area of intervention that is crucial. So as we plan right now, and we're aware of the devastating consequences of this epidemic that is highlighted by the number of overdoses that now actually has been pinpointed by this striking rise in deaths from heroin. And Mr. Shumlin, you may not be aware how important your intervention was for us, making us aware about how steep the increases are in heroin in our country. The CDC had its release for the data in 2011, and over 1 year, we've seen more than a 30% increase in 1 year on overdoses from heroin. So this is a very, very fast-moving trend, and we need to stop it. And the issue is we have the tools to stop it right now. So what is it that we right now can do? We need to educate the healthcare system in the proper prescription of these medications. There are many myths. One of them, for example, as a physician, and it's still believed that many of my colleagues stated, if you have chronic pain and they give you an opioid medication, you are not going to become addicted to it. Well, it's wrong. It's wrong because we are now seeing patients that have never taken a drug that are being treated with opioids, and the lack of knowledge about addiction in their physicians did not protect them from them to becoming addicted. So we need to improve on the educations of medical students, of specialty physicians, of pharmacists or nurses, handling, screening, and treatment of chronic pain. And we need to also implement education on substance use disorders so that they can recognize it. Number two, treatment. It so happens, we don't have many medications for drug addiction, but it so happens that we have medications for the treatment of opioid addictions. We have them. Methadone, buprenorphine, Vivitrol. They work. They work. Not only do they work in decreasing heroin consumption, in preventing relapse, in ensuring that the patients recover, it decreases their likelihood of getting infected with HIV. It decreases their likelihood that they end up in the criminal justice system. And guess what? It decreases their likelihood of overdosing. And yet, with these medications, we're not implementing them. You can look at different numbers, but between 10 and 30% of those that need it get it. So the majority of patients are not getting medications that could prevent these overdoses. Why? Because implementation is not straightforward. You may have evidence, but that doesn't necessarily mean that it changes behavior. And I think in terms of the area of research that is very important is research on implementation to help us understand how to implement these treatments in the healthcare system, in the criminal justice system, because the evidence is already there. Now, as we look into the future, as the Attorney General was saying, we have these gigantic brains, of course, in order to solve solutions. 50 years ago, we were going up there into the moon, right? We uncovered the human genome. We have the capacity to do better in substance use disorders. I'm delighted that we have 3 medications for the treatment of opioid addiction. But how many medications do we have for other diseases? Say HIV. I mean, an example of how extraordinary we can be in solving problems. This was a disease that emerged in the late 70s, really early 80s. And now patients with these diseases have access to more than 30 different types of medications that ensures them they can live basically a normal life. They are going to die of something else, not of HIV. Why? Because we invested the resources on that disease. And yes, the disease of addiction is treated very different from the other diseases. And we need to recognize that we can actually expand on the access of medications. So an area that we as an agency are very much interested, the recognition, on the one hand, that we need better treatments for addiction, but we also need better treatments for the management of pain. Unfortunately, we do not have effective medications to handle severe pain that don't have adverse effects. This is an area that should be prioritized. An area that for us, so we are funding research to develop medications that will not be addictive, that will have much less diversion, that will be much less able to be diverted. And in the addiction field, let's be creative. There are many things that actually we can do. We can actually create for medications on opioids, for example. What we're doing is medications that cannot be injected because you have to ingest them and they have to be digested in your stomach. And for addiction, let's take advantage of what others are doing in other fields: cancer, infectious diseases, development of vaccines, so that we can protect individuals for heroin abuse. In the issue of preventing overdoses, we have naloxone. Naloxone works. If you've ever given naloxone to a patient that is overdosed, the patient emerges with, and if you give it and the patient was on a coma but was not from an opioid, it will have no ill effect. So if we have a medication that works and doesn't have side effects, we should make it as accessible and available as possible. So we're funding user-friendly naloxones that can be applied not just by medical or trained personnel, but by someone that is an observer of someone that may have had an overdose. And also, again, ingenuity. That's what we are speaking about, and we're very ingenious at a lot of things. We're extraordinarily ingenious as human brains. Most of the patients, many of the patients, and unfortunately I also speak with a lot of parents that lose someone, a child, from opioid overdoses. And one of the stories that I hear constantly is they go to wake them up and the child is dead. Many of these opioid overdoses occur overnight. But we have these wireless technologies and mechanisms to detect actually when someone's heart rhythm goes wrong or where someone's breathing gets disrupted. I have someone that calls me when someone is entering in my basement apartment and the police can get in within 5 minutes. Why can we not apply these technologies in order to be able to save those lives? We have the tools. What we need is the will to do it. And I want to thank Mr. Botticelli because I resonate with the statement of the prior two presenters. The way that we're going to succeed is knowledge is not sufficient. It's crucial, but it's not sufficient. You need to implement it. And that requires the partnership between the different organizations and different individuals coming together to solve a problem that is solvable and that is our responsibility to solve. And it's an urgent problem. So as Mr. Holder said, we need to act, and we need to act urgently. Thanks very much.